So I always tell everyone that for doing aesthetic procedures, you need someone who's not just a doctor, but he or she is an artist. We have named our patient as Madam A, and Madam A got the chin made from somewhere. And you can see that it's not connected to the jawline. It's pointy, it's out of proportion. So I'll tell you how the facial maths decides and dictates where the chin width should be, where the chin projection should be. So everyone has a beautiful, unique face, and the features are different on everyone's face. So when you're trying to make them the best version of themselves, you have to keep in mind the golden ratio. You have to keep in mind the artistic eye that the doctor has. And most of the time when patients are coming for these kind of things, to be honest, I'm fixing, and there are very few faces which are virgin faces, and I like to create like it's a blank canvas and I like to draw on it. But most of the time the canvas is already ruined and I'm just trying to fix it. So today we're going to fix the chin. The chin is hanging in the air. It's not blending with the soft tissues around it, you see? So what kind of a chin and what kind of a bone stands on air just like that? It's not a flapper. I mean, it's a part of your face. It's a bone. So I'm going to use something which is going to act and feel like a bone in terms of using the product. And then I'm going to use some hyaluronic acid to just blend that bone with the soft tissues. I'm going to soften up her face and I'm going to bring the aesthetics back to her face to make her look prettier and younger. The longer needle, 20 units. Gauze, please. Okay. I love this when I'm doing fillers. So this procedure is very interesting. It's called the Botox jaw shaving or the Botox jaw slimming. So we have these mastication muscles. Mastication means to chew. So one of the muscles, which is the masseter, is going to become big and fat over the passage of time. Now, it's not just because of the eating process, of course. In some of the patients, when you take their history, they tell you that they grind their teeth while they're sleeping, or they have a habit of chewing hard stuff. So it's like the lower third of your face becomes broader, which brings unnecessary attention to your face and it looks unattractive. So Madam A will give us a clenching action. So can you see my thumb is being pushed out by the masseter. It's a very quick procedure. So I'm using 20 units with a big needle. I'm very far away from the rosarius muscle. So I'm trying to inject into the belly of the muscle and the superficial fibers both. Otherwise, we can end up having a side effect. So I like to, basically inject deep and superficial. So it's a very quick procedure and she's going to see the effect of thinning of her face in next 1 month. It takes time. So now we'll go in the temples. So this is called the temple fillers. Why is it important to do temple fillers in this patient? Because I'm trying to bring the harmony back to the facial features. So if you have disfigured the chin, that I cannot do something because I have to blend with the rest of the face. So I also have to make sure that this is coming in proportion to the cheeks, and the cheeks are now looking way too broader and her forehead seems to go a bit compressed. So what I'll do is I'll try to bring the temple area a bit out. I'm trying to bring the compressed temples that you see in a lot of aged faces. So when you're aging, this gets compressed and the cheeks are looking way too broad. So I'm trying to bring the proportions back. This is one of the areas on the face in which the doctors, they have to be super professional and trained and experienced when it comes to using fillers. And not a single droplet of blood has come out.
Okay, it was a pleasure. Thank you so much.